Welcome back to The Source. My name is Mike Balsom, and joining us now, Dr. Mustafa Hirji, the Medical Officer of Health for Niagara Region. COVID numbers are increasing and obviously causing a lot of concern amongst Niagara Public Health, amongst everybody really. Dr. Hirji, what do these numbers mean to you?
Unfortunately, around the world, we're seeing COVID numbers rising. Europe, they've of course risen so starkly that they've gone back into lockdowns. We're seeing the United States setting records in terms of number of cases and deaths daily. And unfortunately, that's happening in Ontario as well in terms of setting records for number of cases. And in Niagara, we aren't immune to that. We've seen our numbers go up quite substantially over the last couple of months. I think this is, the difficult time of year where we're not really going to be spending time outside. We're going to be spending much more time indoors where the risk of infection spreading is greater. And I think a lot of us are really just getting sort of tired of dealing with all of these restrictions for COVID-19 after 9 months. And I think we just need to remember that, of course, the virus doesn't get tired. It's going to keep spreading. And we need to do everything we can to continue to limit the spread of infection and look at some of the positive news we're hearing about vaccines, that it might not be for that much longer, hopefully.
It's also flu season, but yet the flu hasn't really taken hold in Niagara yet. Is that true?
Yeah, that's true. We've really not seen any influenza yet here. That being said, we often don't see influenza really start to circulate, sometimes even until December, or sometimes even as late as early January. So it's certainly not too late for that to occur yet. Flu shots are out there. They seem to be being taken up in quite high numbers, so that's really good news, and hopefully that'll prevent too much influenza going around as well this year.
Dr. Hirji, I'm hearing from a lot of the public that they're a little bit confused about restrictions. I know in the middle of last week, I think it was Thursday, you came out with some new restrictions for restaurants. And then the following day, Doug Ford, the Premier, comes out, moves Niagara into code orange as of Monday morning. What actually is the rule, and are we still in a bubble personally? I think a lot of people are really confused about what the rules actually are and who actually takes precedence.
In terms of the idea of a social bubble, actually, this goes right back to October 2nd, where when cases were rising, the province decided we're no longer supposed to have social bubbles. We're supposed to limit all of our social interaction to just our household. If you live alone, you can, then combine with one other household, but really that was it, to really limit to that household. And that's been the rule for the last 6 weeks. And our order on, people going out to bars and restaurants is really about trying to align and make sure that that guidance is followed, that when people are out at a bar, a restaurant, a food premise, that they're really only going out with their household or one or two people who are really essential to provide them with health and social support so that we limit the spread of infections. What the province then does is, of course, is they have their own set of rules, which are applied to restaurants, personal service settings, arenas, etc. And of course, the provincial rule always takes precedence.
It was a really unpopular decision amongst restaurant owners, and I think you're really, at this point in time, taking a lot of heat over what you announced last Thursday. How do you deal with that criticism?
It's really hard this time of year for restaurants to be seeing these kinds of restrictions coming in place. They, of course, really struggled through the spring with the lockdown. They were just getting back on their feet, and of course, unfortunately, they are suffering from this as well. I don't think any of us want to really harm our restaurant industry. The unfortunate fact of life is that people are going to restaurants as a place where they have social, connections. And unfortunately, through those social activities, that's allowing COVID-19 to spread. And it's not really about restaurants, it's really about people's social activities. And restaurants are unfortunately the venue where that's happening.
You mentioned vaccines off the top, and there's a couple of them that are sharing some positive news, as you mentioned. What do we look at as far as the timeline for those vaccines getting out and being safe enough for everybody to take them?
Yeah, so, got some interim results from a couple of companies about their vaccines, which are both extremely positive, better than I think anybody was hoping for. So that's really good news. These are interim results. So there's a few more weeks for these studies to complete. One of the positive, side effects of the unfortunate spread of infections in the US is that because there's more cases going around, it actually lets these studies actually progress to completion more quickly. So over the next few weeks, these studies will be completed. They'll be submitting for regulatory approval, and the hope is that maybe even by the end of the year, they could be approved to start having these used in humans. There's then going to be, of course, a whole process of manufacturing enough doses, distributing it around the world, Lots of countries have pre-purchased vaccine doses and actually starting to get into ours. So I'm expecting maybe in the spring, we'll start to have some limited availability for the highest risk people. And then probably in the summer to early fall, it'll hopefully be widely available.
Halton, York, and Hamilton on Monday moved into the red zone. Is Niagara going to be next? What's your feel on that?
Yeah, I certainly hope not. I think one element I'm seeing in our data is that while we were creeping up towards that threshold for red, we seem to have flattened out and might just very slightly be declining from that. So I'm hoping that trend holds true. If it does, we shouldn't be going into red this week yet. I am worried though about some of our other neighbors around the province. I'm thinking particularly of Waterloo region, where unfortunately their numbers are not looking good, and they could well be the next region to go into red.
Dr. Hirji, once again, thank you very much for joining us on The Source.
You're very welcome.